Hi there, this is Dr. Greg with ExpressDentist. Have you ever broken a tooth or seen a crack in your tooth or had pain from a crack? If so, then you'll understand that teeth do that sometimes. They undergo a lot of force, a lot of action with chewing, sometimes up to 200 to 300 pounds per square inch on those very back molars. Yes, they're very hard. They're harder than bone, but they're also somewhat brittle. And because of that, you can get certain types of cracks. So today I'm going to discuss 5 different cracks. The first is craze lines. Craze lines are those little tiny lines that you see if you look really close in the mirror, often in your front teeth. And if you could see down the back teeth, you may see them as well, but they're a very, very fine line, and they're usually confined to the outer surface of the tooth and the enamel. Now, it does indicate there's stress in those teeth, and it's important to have that evaluated to see if there's something going on with unusual bite forces, such as grinding your teeth at night. But craze lines will often stay that way indefinitely, hopefully forever, and not progress to anything more, no further fracture. And so they are definitely something to have checked, but they may not result in anything more. Now, sometimes you can get a fractured cusp. That's the second type of break or crack. And this is where a crack becomes to the point that it breaks away one of those points on your teeth on the side or on the back teeth. Those are called cusps. And when those break off, they tend to be a little rough, a little uncomfortable, sometimes a little sensitive. They don't usually cause a significant toothache in the short term, but these are something that you definitely want to get fixed because the tooth is weak, it's more prone to breaking, it's prone to decay because the inside of the tooth is exposed, and you want to see a dentist and have something done. Sometimes a filling can be done, but usually you're looking at having a cap or a crown put on the tooth, or a partial cap or crown known as an onlay. That can restore the tooth back to basically 100% of its original strength. Now, number 3 is cracked tooth. How is that different than craze lines? Craze lines are those fine little lines on the outer surface. A cracked tooth is a crack that goes in deeper to the tooth to the point that you may have symptoms. Now, some cracked teeth don't have any symptoms. They just simply break. But other times you have some pretty good warnings. And those warnings are a combination of 2 things: cold sensitivity plus sharp bite pain when you bite down on something firm or hard. It's one of those zingers that makes you sit upright very quickly. So if you have those 2 things together, it's most often a cracked tooth. And even though the tooth is still together, it's got this crack that's extended into it, and it's spreading a little bit when you bite down, and the cold is seeping through it and getting close to the nerve. So that's a warning system, and it's definitely something to get looked at and treated. In most cases, a cap or a crown can be done on that tooth, and it'll take care of it. That'll be the end of it 9 times out of 10. In other cases, that crack may be deep enough that you may need a root canal prior to having the cap or crown done. Now, the other possibility, number 4, is a split root. This is where a crack goes deeper down into the tooth, actually gets below the gum line, and separates the roots. So this would be like in a multi-root tooth, like a molar. So think of a lower molar having 2 roots going down, one on each side like a pair of legs, and this crack goes through the tooth and actually breaks those 2 roots in half. And in that case, that tooth needs to be removed, and you may want to consider a solution beyond that for a replacement. Now, the other possibility is number 5, which is a vertical root fracture. And this would be where a crack doesn't go down between 2 roots, but it goes down a root. So it could be a front tooth, which has a single root, and the crack just goes from top to bottom all the way through the tooth and splits a single root in half. Or it could be in a molar, where it goes down 1 root and splits that root in half. So it's very similar to the other type of root fracture. But it's also one of those irreversible situations where the tooth needs to be removed, even if it's not hurting, because it's going to become infected in some degree at some point. So that's something you want to get taken care of. So a few things to think about when it comes to teeth and wear and tear and cracks and craze lines and split roots. There's quite a bit there that sometimes needs to be addressed. And at Express Dentist, we have a full network of trusted dentists around the country, and we can help you get connected with one in your area. So if you suspect that you're dealing with a cracked tooth, there's symptoms, there's no symptoms, doesn't matter, you just need to have that checked or treated, then reach out to us and we will help you get connected with a dentist in your area. So take care and be well.